All right, so for this video, we're going to be using the foam roller for the glutes, so the glute max and the glute med. Mostly, when you do your rolling, start on like the inside of your glute. It's usually a little bit less tender, and then as you roll through that, you can start working to the outside of the hip and some of the hip flexors, which are usually a bit more tender. So when I get on the roller, right, I'm just trying to have my hands down like this and my other foot for support, and I'm just doing little movements up and down. So I'm just working through basically like the whole glute here. And then as I find some tender spots, what I'll do is hold there for a couple seconds. Just let the muscle relax a bit, like, 10 to 30 seconds, depending on how it feels. Hold it there. And then once it starts to feel better, you can rock back and forth a little bit and then just like work it out like that. And then when the inside feels better, then you're going to turn a little bit, get on your elbow, and you're going to start working more of the side of the hip. So this can be a bit more tender than the backside for most people, right? So if your leg feels tight, just try to stay on a spot till it can relax. You want your leg just nice and loose like that, so you know you're not tensing up on the roller, right? So same thing, I find a spot, just hold it there, 10 to 30 seconds, depending on how it feels, right? And then once it feels good, just sort of flush it out a little bit. And then we're going to do the same thing on the front side. So now I'm leaning a little more forwards and I'm on like the front of my glutes, and I'm getting some of my hip flexors here as well. So you can work through here. Same thing, find a spot, hold it, and then see my legs nice and relaxed. And that's pretty much it. So you work through the whole hip, and then if you're doing a stretching day, you can do your stretches or some kind of activation like a glute bridge or clamshell is good to do after that. So give it a try and see what you think.